The flu has recently landed more people in the hospital nationwide than it has in the last decade. That was the concerning message from the U.S. Centers for Disease Control and Prevention today. CBS 2 investigator Megan Hickey has been digging into the flu cases here. She joins us now. Megan, hospital systems across our area have also been seeing a surge.
Right, Joe. Hospitals like here at the University of Chicago are seeing a very early rise in cases. And while hospitalizations are not as bad here as they are in other parts of the United States, doctors are warning it will only get worse if residents don't start taking the right precautions. University of Chicago Medicine is seeing it.
November hospitalizations are higher than what they have been in the past.
So is Northwestern Medicine Immediate Care.
We're seeing an increase in the number of positive flu tests within the immediate cares in the outpatient setting.
Loyola University Medical Center, too.
Right from the beginning of October, our Loyola numbers show an uptick in flu and a big rise in the last couple of weeks.
Several other hospital systems across our area tell us they're seeing a spike as well. And even if they're not seeing a rise in the need for flu-related hospital beds, they worry that will come soon. The CDC is urging people to get vaccinated.
Right now, we're not seeing as many flu vaccinations happening, and that likely is maybe the driving force to current uptick that we're seeing right now.
And offering to assist states that might need additional support. While flu cases were down significantly during the pandemic,
and it's not that they went away. We just didn't transmit it as much. And we didn't transmit it as much because we took more precautions. And so the same thing is true now. If we take more precautions, we'll spread less flu.
Dr. Emily Landon says another reason is that studies have shown that our immune systems don't work as well after we've contracted COVID.
That means that our immunity to things like influenza, RSV, other colds, and other things that are going around isn't as good as it was before. To a certain degree, you might say that people are somewhat immunocompromised after they've had COVID for a period of time.
So what do we do now? Again, doctors urging everyone to get that flu vaccine and to remember those social distancing rules that we learned during the pandemic. And yes, that does mean wearing a mask in public. Live at UChicago Medicine, Megan Hickey, CBS 2 Investigators.
Thank you, Megan.